want to make a mistake when it comes to your children's health and safety, and knowledge is power. So Dr. Lori Barr, a pediatric radiologist at Austin Radiological Association, joins us this morning with key information on what you need to know. Good morning, Dr. Barr.
Good morning.
Thank you for being here.
It's exciting to be here. You know, Miley Cyrus recently was diagnosed with tachycardia. That means her heart was beating too fast.
Yeah.
And part of that workup is chest x-rays. And you know, it's interesting because even though we think of a chest x-ray as just a picture of the inside of the chest, there are 5 different ways to do chest x-rays.
Really?
Yeah, there are. So there are some mistakes that people can avoid, 3 common mistakes people can avoid when your doctor orders imaging on your child that I'd like to share today.
Okay, so this is going to be important information if you have kids, and which I anytime we've got kid stuff now, I'm like so intrigued on what to do, what's best for them. And so when we talk about different kind of medical imaging, there are 3 mistakes that you said. Let's list all 3, and so people can kind of become aware of what not to do.
So the 3 mistakes are, 1 is going to the wrong specialist, 2 is getting the wrong exam, and 3 is having the exam taken in the wrong environment. So when you're talking about kids, now think about it. How big were your twins when they were born?
5 pounds.
Wow,
yeah.
So that's pretty small, you know?
Yeah.
And how big are the football players on our local high school team?
Some probably 2+.
Pounds. Yeah. So for pediatric imaging, you know, that's a wide range. And if you know, your doctor is a specialist at interfacing with you and your child and knowing what's wrong, and then they order the appropriate test that they think, but sometimes they don't know how to get the most out of that test. So just like you wouldn't shoot your whole wedding with your smartphone and your best friend holding it, you know, you're going to hire a professional photographer to video it. It's the same thing with medical imaging. When you want the best pictures for the inside of your body and want to get the most information, whether it be video pictures or still pictures, you go to the specialist, the production team who can make that happen. That's the radiologist and the technologists who work with radiologists.
Yeah, and ARA is doing some great things over there with that. It's such a great analogy. You said you wouldn't go to your wedding and take just iPhone photos. You need to find that professional to do it. And there's different kinds of imaging, right? So not just x-rays.
Not just x-rays. We are radiologists are specialists at how energy works with the body. So we take pictures with ultrasound, with x-rays, with radioactive materials that we have patients drink or eat or inject into their bodies, and also with magnetic and sound waves.
So it's interesting here this morning because we've got a floating beta fish sitting behind us, and you know, the question is, why do we have this fish? So
this is our new mascot at our Children's Imaging Center, which is located just adjacent to the Dell Children's Hospital on Barbara Jordan Boulevard. And this is our beta fish.
What's up, bud?
He does not have a name yet. And we did some ultrasounds on him with the latest equipment that we've gotten for pediatric imaging. Our children's imaging site, even though we have 20 locations across town, we have only 1 site that has all of the equipment we need to do patients from the size of newborn baby size all the way up. And to demonstrate that, we actually videoed our beta.
So this is them doing the ultrasound on the beta fish.
Right.
This is pretty cool. Look at that thing.
Yes. He's going to wave at you. See him waving? Oh, yeah. He's waving at you right there. So,
so this is some of the technology that you're able to use.
That we're able to use. And what's important with medical imaging to remember is it's all about what you can see. So if you go to the right specialist, that's important. If they use the right equipment, like we used a different wand on this beta fish and we couldn't see him in the bowl at all with the same machine, just using the wrong wand to scan with. And then the third thing is environment. Think about your twins. Think about how difficult it is to get a good picture of both of them at the same time.
Smiling.
Or with this guy, when he's swimming around the fishbowl, how is the environment? How are all the people who work there supporting that? Did you know that there is a specialist training for ultrasound techs, a new specialty in pediatric ultrasound? There are only 10 pediatric ultrasonographers in the state who have that registry, and we have 3 of them at ARA. That's out of maybe 200 to 300 ultrasound techs in the whole city. 3 are pediatric specialists. Only 3.
So they kind of know what they're talking about. The Austin Radiological Association has been doing great things here in the Austin area. Some information on the screen on how to get a hold of them. If you have any questions whatsoever about something that's going on with your kids, they can most likely find out what the reason is. And real quick, I know we're running out of time, there's a contest going on right now with this beta fish. they're trying to find a name for the
Wait,
fish.
we need a great name for our fish. So you can post a name on our Facebook page at Austin Radiological Association, or tweet us. We're at AUSRAD, AUSRAD.
Perfect.
So for this month.
Just going to throw this out there. 2 names, Jordan or We Are Austin. Might be kind of cool.
Okay.
All right. Thank you so much. Really appreciate it.